and hard of hearing in the state of Michigan. We're going to begin this meeting, and we're going to start with an announcement from Heather Keel.
Welcome. This is Colleen. This is the in-person meeting of the Board of Interpreters for the Deaf, Deafblind, and Hard of Hearing, being held today in Livonia, Michigan at Madonna University. This meeting is being live streamed and recorded. Thank you to the board members and the members of the public who are in attendance today, and to those joining us by Zoom. Before we get started, a few items I would like to go over. The agenda and Zoom information are posted on the Michigan Qualified Interpreter website, found at michigan.gov/BCHS. After the meeting, the approved minutes will be posted on the website. The in-person meeting and live stream are being provided with ASL and captioning. People with disabilities requiring additional accommodations to participate in the meeting can email laura-bchs-qualified-interpreter@michigan.gov. For the public comment part of the meeting, the in-person audience will give comments first, then those on Zoom. We are using the Zoom webinar platform, and your video and audio are currently shut off. When it is time, participants on Zoom who wish to comment should type comments in the chat feature. If you wish to be on camera, click the icon at the bottom of the screen to raise your hand, and we will then recognize you and ask you to turn your video and audio on. Additionally, board members and department staff are not permitted to respond to public comments. Please limit public comments to around 3 minutes. Thank you again for joining today. I will now turn this mic over to department staff member Heather Keel to call the meeting to order.
Apologize for that. This is Sarah. That was Colleen.
This is Heather Keel. Good afternoon, everyone. It is 4:09 p.m. I will first go ahead with a roll call, and then we'll read the communication policy. Mitch Hillally.
Here.
April Davidson.
Here.
Sarah Houston.
Here.
Miriam Andrade Cuevas is not present. Diana McKittrick.
Present.
James Check.
Here.
Rowan O'Doherty.
Here.
Miles Hudkins.
Here.
With that, there are 7 present, and we do have quorum. Next, I am going to go ahead and read the communication policy. The following communication policy is proposed for the Board of Interpreters for the Deaf, Deafblind, and Hard of Hearing, and visitors to facilitate successful discussion and debate during meeting proceedings. It is intended that by following this policy, communication will be achieved for everyone present and will improve the effectiveness of the meeting. Board members should wait to be recognized by the chairperson to speak. The chairperson will recognize the speaker by name and allow for adequate discussion of all issues brought before the board. At any time during the meeting, if any board member or public attendee needs adjustment in communication facilitation, they should get the attention of the chair by raising their hand. All voice votes will be taken by raising of the hand. Avoid sidebar conversations. No comments from the public will be entertained during board discussion and should be held for the public comment section of the agenda. Board members are not permitted to respond to public comment. And lastly, public comments are limited to 3 minutes. Next up, we will move on to agenda item number Sorry about that. We are going to move on to agenda item number 3, approval of the agenda.
This is Mitch. I move to approve the agenda.
second that. This is Miles. Motion from, any discussion?
This is James. I move that we add old business and we add the discussion with FAD and the Fluent Association of the Deaf. Just a very brief update that we add that under old business, please.
I second that. This is Diane.
Okay, so Deanna, you second that? Wait. This is James. I'm proposing, this is an amendment. I forgot to say amendment. Friendly amendment. To approve the minutes and to add the community conversation with FAD under old business.
This is Mitch here. I accept the friendly amendment. And now we are going to, all in favor? Aye, and it is passed. Moving on to item number 4. That's the voting for the chair and vice chair. Go ahead, Heather.
This is Heather Keel. And we would now like to entertain nominations for chair. Are there any nominations?
Diana, you have a nomination? I nominate myself as chair. Okay, I like it.
There is a nomination by Diana for herself. Is there a second? Sorry.
I second that. This is Sarah.
Are there any further nominations for chair? With no further nominations, is there any discussion on the nomination? The nominee can address the nomination if they want to.
Would you like me to say something? I would be honored to. Honored to be a chair. Is that enough? Thank you. Don't embarrass me.
This is Heather. Yes, that's perfect. Thank you. Is there any further discussion on the nomination?
No.
With no further discussion at this time, the nomination for Diana McKittrick, seconded by Sarah Houston, we will now do a roll call vote. The nominee, as long as they receive the majority votes, will take that role. Mitch Halali,
Yes.
April Davidson,
Yes,
Sarah seconded already,
of course, yes.
and Miriam is absent. Diana, you nominated, so yes.
I guess so, yes.
James Check,
Yes.
Rowan O'Doherty,
Yes.
Miles Hudkins.
Yes.
There being no objections, Diana McKittrick is now chair of the board.
Thank you. Thank you all. Thank you.
We would now like to entertain nominations for vice chair. Are there any nominations?
I will be acknowledging you, James.
Thank you, Madam Chair. I would like to nominate Sarah Houston for vice chair.
Wait, am I the chair now? Do I start, am I, hold on. That's no problem. I just wanted to make sure that I was being politically correct here. Sarah's saying it doesn't matter to me. Would you like to handle the meeting today? Is there plan? Was this planned? Did you do this to me on purpose? This is Sarah. I'm more than willing to handle and run the meeting today for this.
That's great, thank you. A little awkward if we have to get up and actually switch seats.
So we have a motion for Sarah Houston to be vice chair by James Check with a second. Is there a second?
I second. This is April Davison.
So we will now do a roll call vote. Oh, are there any other nominations for vice chair? With no other nominations, we will move on to the roll call. Mitch Halali,
Yes.
April Houston, second. Sarah Houston, or sorry, I was reading down to the next line. April Davidson,
Yes.
Sarah Houston,
I think April Houston sounds really good. However, yes, I accept the nomination.
Miriam Andrade Cuevas is not present. Diana McKittrick,
Yes.
James Check,
Yes.
Rowan O'Doherty,
Yes.
Miles Hudkins.
Yes.
There being no objections, Sarah Houston is elected vice chair. Would you prefer that I turn it over to Sarah or to Diana?
For what is this? For what did we decide? Are we switching roles or? Hold on one moment. Oh, the vice chair, that's right. Oops, I guess I need to stay seated here.
I was going to say slide the papers, put them back this way.
Now we're going on to the approval of the January meetings minutes. Did we already review the minutes, or do you need time? This is April. I want a motion for a change during public comment from Erica Chapin. It says dead and hard of hearing, not deaf and hard of hearing. If we were able to change that to deaf, D-E-A-F. Okay, so we will remove the deaf to deaf, D-E-A-F. Do I hear that we are accepting the minutes with correction? James?
This is James. I move that we change that last paragraph, the announcement. It says Black Deaf Associations. That's not what it should be. It should be the Detroit Black Deaf advocates.
Advocates with an S. Okay, just clarifying those corrections. Do we have any more corrections? We have 2 corrections currently. So I hear that we're accepting the minutes with 2 corrections. And James?
I move that we accept the minutes with the 2 corrections.
I second that. This is Sarah. Sarah seconds this. Does the board approve? One moment. This is April. I withdraw my motion, so James' motion can proceed. And I seconded that. This is Sarah. All in favor? Any opposed? No, none opposed, so the motion passes for the minutes with the corrections. And now we're opening the old business. Who is going to be speaking to the FAD community conversations? Is that you, James?
Yeah, I can do that. Thank you. All right, I'm looking at, okay. I want to thank Frida Morrison on the board welcoming us up to Flint at FAD, the Flint Association of the Deaf, setting up an event. The board was represented by 4 of us, Diana, Sarah, myself, and Mitch. The 4 of us were in attendance, along with everybody at FAD, and we wanted to have a conversation, talk about the rules, the interpreting rules, and to summarize some points of what's really going to change. What is the board doing? What proposals are coming from the board to change those rules? It was a nice opportunity for the board. We know that many of them come to our board meetings many times and listen. There's public comments that are made. But as far as us, we just have to sit there and not say anything and watch those comments respectfully. So the chance for discussion and interaction and communication, that event was very nice. Allowed us an opportunity to clarify what the rules are, some of the history, what is the board's responsibilities, and plus also super valuable was to allow all those deaf there to ask questions, raise their hand and say, what about this? What about this point? What about this? This is important to me, etc. So we had a nice interchange, a nice connection with the community at that event. So we want to thank everybody here, my fellow board members who came and attended that. Hopefully, we also want to thank Heather as well. Heather came and Peter came. So it's nice to have them 2 there, show some representation from the state agency there. So very important, and just feel like that event really could be taken and suitcased to other places around the state. Deaf associations or other organizations that support the deaf, deafblind, and hard of hearing communities and goals. So the board's goals as well. So if we can have some collaborative efforts in the future, that would be great.
I would like to amend, or I'd like to add Many of the deaf people, after this session, after the board members left, many of them came up to me and said they would like to see this in Detroit, that they would like to see it up north and different counties, and also some were in the Tri-County, and some were having questions about the code of conduct and professionalism. They weren't aware about what that is, and they wanted to have a workshop about it. It felt quite overwhelming when we're talking about this, but the audience did appreciate that, and the community did, and they would like that. They felt like 2 hours wasn't quite enough to get it all in, but it was a great learning experience. So it was a good experience, and we're really happy that we were able to attend the event, and we were able to have that opportunity. We hope to have other opportunities to do the same thing at different locations across the state. I
Thank you.
recognize Mitch.
Thank you. Yeah, this is Mitch speaking. I wanted to add on to what Diana said. Yeah, there was a lot about the responsibility between the board and then MDCR, and I know it's BCHS's responsibilities and MDCR their responsibilities. So trying to compare those, if an interpreter doesn't show up to my appointment and I want to file a complaint, do I file it here? Do I file it with them? Where do I file it? If no interpreter shows up, do I file it here? Where do I file it? And it's complex, right? The system is complex. So the four of us, the board members, really took that in, and we learned that we really need to collaborate with MDCR to make sure that we are educating the public about what their rights are. Current rights, if there's new rules enacted, what rights will come with those. And under MDCR, their authority, what jurisdiction do they have? So that was my biggest learning that came from that session.
I enjoyed interacting with my people. That's my home in Flint and Flint Association of the Deaf, so I always really enjoy being there and being around my people. And they are motivated to learn, and I think it was important that we set up educational opportunities for the community and the deaf community all over the state, and I support that effort of putting that in place and having many town halls for that type of informational sessions. We're going to wait for an interpreter switch. We'll wait. Diana speaking. We learned some new things during the questions. There was things that I hadn't thought of, and I'm sure that my fellow board members also took notes. When we talk about DI, the deaf interpreters, talking about the hearing test. And someone had come up and said, well, hearing people need to have a hearing test as well. Huh. So we need to make sure that they can hear as well. That was something new, a new concept to me. I thought that was quite interesting. All right, are we all settled in the audience? Interpreters, are we good? Fantastic. Do you have any old business? Is there anything more to discuss? Nothing else? Moving on to new business. And we have some updates to share. MDE John Kirsch. John Kirsch. Okay. You're going to come up for that. I'm not sure where it is that you're supposed to stand. Over here, I believe it is. I'm a little tall.
That's vertical discrimination. All set? Everybody see me okay? So I'm John Kirsch. I'm the deaf and hard of hearing educational consultant with the Michigan Department of Education, Resource for Deaf and Hard of Hearing, MDERDHH, we're calling ourselves. May recognize us by our old name, which is MDELIO, Low Incidence Outreach. That name is no more. We're representing deaf and hard of hearing people, and so we wanted to make sure that, as well as blind, low vision individuals as well. So we wanted to separate DHH and BVI. We have consultants for both of those groups. We finally have our new names. We've made that change this year. Our website still has the old name, but by this fall, we are hopeful that the new name will take its place there on the domain, and we'll update those things. So just a couple of updates from myself. First, this past fall, Laura and BCHS contacted us, and for what reason? Well, the rules and regs, the amendments, they want to have some discussion regarding the part of that with educational interpreters. And so we provided some feedback after reading those rules. We got together, we had some discussion, provided that feedback on what we thought. So in July is the first time there's going to be a statewide conference specifically for educational interpreters. And so that information's on our website as well. It's under mdelio.org. There's a web page there. That conference is going to be July 17th and 18th. It's on the events page. So if you know of anybody who's an educational interpreter, get the word out. Please share that information. And thank you.
I believe we have this is Diana. Does the department would like to go ahead and, or are we going to go back here? Okay, that's fine. The Division on Deaf, Blind, and Hard of Hearing representative is going to come and speak to us. Hello, okay. We got the same similar height here. Hello, everyone. Good afternoon. It's nice to see you all. It's nice to see the audience attendance today. My name is Elena Lale. I'm from the Division on Deaf, Blind, and Hard of Hearing. My new title now is Communication Access Specialist. My former role was Deaf, Blind, and Hard of Hearing Liaison, but I've been promoted to Communication Access Specialist. And in that role, we're quite entrenched in enforcement. As far as MDCR, and what we do is enforcement. We don't do investigation on cases. Our division doesn't. We will be the mentor, in enforcement. So if they're an investigator, has a deaf or deafblind or hard of hearing person file a complaint, that's when we would come in and become a liaison between the investigator and the complainant. We would come in and guide them. So I'm pretty much their navigator during that process, through the entire complaint process from beginning to end. This is a new position. It's great to have this, and this is hopefully will encourage people to file complaints and feel comfortable filing a complaint and confident in that. We know that the complaint process can be quite overwhelming at first, so we're here to hold your hand, so to speak, step by step. So we're excited to announce that. We're starting that, and that's effective now. We will be also hiring. Our department's going to be hiring a new position, which is my previous position. And this is a very, it's going to be out to the public very shortly. Kenya Lowell, our new director. If you don't know if you know her, we had our previous director, Annie Uraski. She has moved to a different position, and now we have Director Kenya Lowe. They've been in this position since January. It's been exciting. We've been working diligently to make some new adjustments and changes with the goal of making our division more collaborative for our organizations and promoting and our visibility and our reputation and our name, getting us out there. There's a lot of changes that are coming, and we're quite excited about that, about what this year will bring. So thank you. This is Diana. Thank you. Thank you for your updates. We really appreciate that. Okay. Now I'd like to start with the department's update. If you'd like to start with that, would you like to do that?
Here, oh, there we go. I think we're going to have Innovi start us off and give an update on the survey for the community.
Can you see me clearly? All right, excellent. We're going to go ahead and get started. I do have some slides that I wanted to present, but I'm not sure if we have the capability to do that, if that was available. I'm going to try to briefly do that. If it doesn't work, we can still move on. I can just present. Hold on one moment. We have an issue here. This is a little bit confusing. We have an interpreter and also someone signing on screen. So one moment. We don't need the interpreter, just to have Sam signing. My apologies. You can begin again, Sam. All right, perfect. Can you also see the screen of me signing? Is that a yes? All right, beautiful. Thank you. Okay, hello, the QI board members and the Michigan community. My name is Sam Waltz, and some of you remember me from October of 2024 is when we joined the QI board's meetings. And we're excited to talk about our project, the Michigan Interpreter Needs Assessment. And then we're going to talk, in January, provided a video update. And now we're here again to provide you with more updates, and we have some exciting information about the assessment being ready for all of you to participate in. Some of you might have seen some postings that have been sent out, and that information has been sent out to the community. Some of you are ready to take that, and focus groups are ready to get on board. And we want to talk today a little bit more about opportunities for questions and collaboration, have that dialogue and clarify some questions about the needs assessment and ask for your help as well and your support. The team, we're not based in Michigan, so we're relying on you heavily in the community to help us out with that and be able to engage the deaf community and interpreters to participate in this assessment. So let's talk briefly about the updates about the project goals. Okay, Michigan Interpreter Needs Assessment. We have 3 of those here, 3 goals. Laura is the lead on the needs assessment for the QI board. Innovi has partnered with them and taken that on with the goal of getting an idea and a feeling and a pulse of what's going on in the state of Michigan. So we have the 3 groups, the deaf, deafblind, and hard of hearing members in that community. And we also have, oh, one moment, we have a communication issue. One moment. We have some technical issues. Just give us one moment to get all set up here.
Sam, they can see you signing on Zoom, but they cannot see your PowerPoint, so one second.
the interpreters can begin, I believe. Can you see me, Sam? Oh, we're ready for you, Sam. You go ahead and get started again. All right, this is Sam. Thank you. Okay, thank you everyone for that getting everything all set up. Again, let me start over. And so we can talk about the project goals for Michigan Interpreter Needs Assessment. The goals is that we have these 3 priorities of these groups that we're focused on for data collection. With group 1 being the deaf, deafblind, and hard of hearing community all over the state. Then the deaf and hearing interpreters that are currently in the workforce in Michigan. And also people who want to become interpreters. They might be in a ITP, perhaps they haven't started the program yet, but they are curious about the field. So we have the 3 categories there. There's other categories, for instance, educators, parents of deaf children. Of course, they can participate in taking the survey with the understanding that this assessment is focused on those 3 groups, meaning that the survey itself is populated questions that are based upon those focus groups. But other groups can come in and answer the questions, but we do have limited questions available for them. With the goal of, what is the goal of communicating with those 3 groups and getting information? So we're trying to figure out what the challenges are and experiences with the hope of uplifting of how we can keep our current relationships in Michigan and how to expand the interpreting field, and also how to best accommodate and support the deaf community with interpreters. And what does that look like? Moving on, we also want to collect more information so we can give information to Lara on how they can support the interpreter system. And the 3rd goal is building those relationships with Lara and the community organizations and the institutes as well, and those community members. Next slide. So now I want to ask for your participation and your support in this. You can see on the slide here, there's a QR code for this survey. You can feel free to take a look at that. Also, we have the QR code for the focus group. If you want to sign up for that, that will have the data and information available up there. That focus group, the rules were sent out 2 weeks ago. And the survey has told us a lot, given us a tremendous amount of information. So thank you to all of those who've already taken the survey and for those focus groups who have signed up. We do need more. We only have a limited number of participants in that focus group, especially in the deaf community. So if there's those of you who are willing to partner with us and support us in sharing that information and getting that into the community, so that way we can get that data, it'd be very valuable. We have different ideas on how the NAV team can recruit members and expand our information gathering. So please let us know if you have any ideas. We worked with DEFCAN and DHHS in Grand Rapids. They both have been more than willing to open their doors and invite the community members in to support them and helping with the recordings, helping with the survey. So our team is grateful for that support. So what are the next steps? The team, and now until June, will be doing data collection with the community. When we're done with that in June, from June to August, we're going to do the analysis of that data and develop a report and bring that to the Lara's team so that way they can learn information from that. And they plan on releasing that report publicly. And that's it for me today. That's my update. If you have any questions or comments from the board or the community members and you're not sure, I'm not sure if I can accept comments from the community members currently, but I'm here to comment if you need me to. Thank you.
I'm going to be next, so I don't know if you guys need to move or not.
Chair recognizes Sarah Houston. Thank you, Sam. Thank you very, very much. We appreciate all the work that you've been doing. You mentioned something, two different things, DHHS and DEF CAN. So I just wanted to give some more information, some other agencies maybe that you could utilize. MSDAA, the Alumni Association at MSD. I think they would be valuable. We could ask them. Flint Association of the Deaf in Flint as well could assist there. CAC, Communication Access Center, another agency, would, I'm sure, be able to help with that. And then also, Black Deaf Advocates in Detroit as well. I think if you could get a hold of some representatives of those agencies, they could help as well. So we just wanted to mention those additional resources maybe that could help with getting to the community and also getting their feedback. So just wanted to share that. This is Diana speaking. And then also we want to add, the Flint Deaf Senior Citizen Group. That group meets twice a month. They're also a very good group. So put you in touch with the senior citizens in that area. Recognize Rowan. Hi, this is Rowan speaking. I've already looked at the survey, already filled out the survey myself. I really have two questions. For the questions themselves, how did you come up with them and who decided which questions? Because when I looked at it, of course, I'm from West Michigan, the west side of Michigan, and our issues are a little bit different than the east side of Michigan. So a lot of those issues that were covered seem to us to just kind of touch on the surface. They don't really go in depth. And so I was just wondering, how we came up with those questions.
Hi, Rowan. This is Sam speaking. Thank you for your question. So our needs assessment, we have, hold on one moment, this is a communication issue. Okay, we can begin again. Yeah, we don't need the interpreter, right? All right, moving on. Okay, this is Sam speaking. Rowan, to answer your question, we started with standardized questions. And then we brought them to the community members, to those, for instance, like Mirrid, and made connections with MDCR, and had some suggested questions there and about what type of questions should be asked. Once we populated those, we had a draft, which we showed the LARA team, and we had a conversation about that and had some discussion. Also, we had the QI board, who has already taken their own subcommittee that is focused on the interpreter shortage in Michigan. And they gave us some data, which was wonderful information that helped us populate questions that needed to be included in the assessment. We tried to follow the standard questions that other needs assessments have had for different states, for instance, Arizona, Minnesota, Louisiana. So we tried to follow that because we wanted to make sure that our collection of data in Michigan, we could compare to other states, that we already have the data. And we know that there isn't a lot of data that's out there in general related to the interpreting field and services. It's quite limited. So that's something that we can work on as far as the questions and how to standardize the field in those questions and improving in general. And then related to West Michigan in specific, just so you know, we took two different approaches for the needs assessment. The survey itself, and then we have the focus group interviews. And the surveys were more to have to do with demographics, to learn more about accommodation preferences. The focus groups, the interviews, that's where the real meat and potatoes is. That's where the data is. That's where you're really getting below the surface and finding out what's happening in Michigan. And that's the reason that we ask people to please sign up for this conversation. And Northern Michigan needs to participate, West Side of Michigan needs to participate, because those questions are going to be focused on their unique experiences and perspectives. So that's really where we got that information, because we're trying to target the community. Hope that answered your question.
It does. This is Diana speaking. My question to you is the results of your survey. What kind of data are you going to give us? I mean, is it going to be suggestions on how to improve, or just going to be boom, 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 data, and that's it?
This is Sam speaking again. So our final report will be showing the survey results. It'll be more of a graph and an information of different quantitative information with a mixture of qualitative information that'll reflect the experiences of the focus groups and the interviews. So we're not just going to be showing you the data and that's it, and you'll have to figure it out yourself. No, we're actually going to include more information about what that impact means from that data. And it also includes a lit review, which means we're going to look at different states and do a full assessment and get a whole picture of what's going on within Michigan compared to other states as well. So the current recommendation for the LARA and the Qualified Interpreters Program and the long-term considerations, we thought about that, and that is going to affect the long-term behavior of what the department decides to do with that data.
Okay, does anybody else have comment? Recognize Mitch. Hi, this is Mitch speaking. Hi, Sam. Thank you for all your comments. I'm just curious. You mentioned that you did, do surveys for other states. Did you find any other, like how to recruit people, how to, recruit people from, far away rural areas, or, more in the deaf-blind people? Do you have any other statistics or information from other states that would help us to approach recruitment here in the state of Michigan and for the focus groups?
Mitch, I just want to clarify, you're talking about recruitment for the focus groups to participate in the data collection specifically?
Yes.
There's different approaches. We have several strategies here. We're talking about in 2 different states. We just finished ones in Maine, which was incredibly rural. That state is. Everyone is quite far away. It's a grassroots community. And we also have the state of Louisiana. We face the same challenges there. Those approaches, typically we would be there in person. We would arrive in person and we would show up and do a town hall type of community engagement. We would go out to different deaf events and connect with, network with different organizations and speak about the goals of the project and announce it there. That really helped with the supporting of trust and helping people feel comfortable to work with the NAV team and get to know exactly who we are and that approach. And other states, we also did that. We did a brief data collection where we did only virtual. We talked to the LARA team about that as far as should we do virtual versus in person. And this project is going to be a virtual throughout. It's a limited scope, and that's where we're really going to rely on the community members in Michigan and the people who have already built trust with your state to help us be able to share this messaging and the goals of this project. So that engagement is important because this project requires some creativity and has some creativity in our collaboration. Our team is fully available for whatever you want to throw our way or any dialogue. If the deaf community might feel unsure as far as what this looks like, feel free to have them FaceTime me, or we could video phone with them to have that discussion. So that is one challenge that we're facing. We've talked to the LARA team and we brought that up, that this is the only needs assessment that they're doing. Nope, this is going to be a continued project that is going to continue. We're going to continue to collect data. This project is just the foundation of it. do this ongoing data collection, but we need people to participate and we request your support for the ongoing research from the state.
This is Mitch. Okay, I understand that. Well, is there any type of elevator pitch or something that we can, hey, I'm going to a deaf event, I'm trying to recruit some deaf people to the focus group. What do you typically, if you were me, what would you say when you're there to try to convince them to participate?
Sure, this is Sam speaking. First, we talk about our company, exactly who we are at NAV. We're a deaf-led organization. We're leaders in developing organizations and companies. We have a diverse amount of experience in different communities in the state. And the decision makers and the community members, our goal is to bring them together. That's the goal, that collaboration piece. We believe the best approach is data and data-based decisions. And we have to collect that information and get that out to the community, and explaining why we want to do that. As far as those three approaches to data collection, there's the focus groups, the survey, and then we have the interviews. So we have that wide range. We want that wide range of information, of experiences, those unique experiences as well. And people from underserved communities, it could be those who want to engage. We don't want just the run-of-the-mill messaging. We want a diverse perspective, and we want to include everyone in this. And sharing the goals of the project, like we just showed you, that's critical. And sharing timelines for the project. For example, the community can expect to learn more about it at this certain period of time, so they can know what to expect, and showing them the dates, what the results will be, which means transparency. So acknowledging that we're being transparent with this data collection. Each project is a little bit different with the goals and scope. And this project, we've already talked about those three goals. So if we were Mitch, I would say start with talking about the three goals and encourage people to take the survey, the assessment, and sign up for focus groups. If they don't feel comfortable doing that, have them reach out to the team. mina@inav.com, and that way we can have a conversation about what it looks like and expand on that, or we could do a one-on-one interview. There's a lot of options that are available to the community in order for them to be engaged in this project.
Great, thank you.
Thank you, Sam. This is Diana. I look forward to your report and seeing the results of your report, and also your focus group. Hopefully, we're able to recruit enough members of the community to participate. I do know, I do have a question for you. Let me back up here. So your report, are you going to be doing a summary in ASL? This is Sam signing. I'm sorry, Diana, I saw you, I was nodding. But the answer to that question is, I want to acknowledge really quickly my colleague. This NV CO is here. Shane is here. You want to say hello?
Hey, everyone. Yeah, my name's Shane Feldman. This is my sign name. I'm the CEO for Innovi, and I'm partnering with Sam on this project. She's done a fantastic job in support of us, and super excited to be working with you as well. I showed up at the last board meeting, learned a lot from you about the ITP programs, their goals, their interests. And so we're coming to Michigan. I recently met with some individuals there from DOD, DDBHH, out in the community. I had some meetings with the Flint Association of Deaf as well, and Detroit, and Mirrid as well, met with their president. So starting to build relationships with those organizations in Michigan so that everybody understands what's happening in the community and that we can build a relationship and get that trust. So fantastic group of people, so much. We appreciate the community for supporting the project. It's going to benefit all of us.
Oh, and your question. So At the very end, the report of your survey and your summary of what your outcomes are. A lot of the people in the deaf community will be participating in this, so they would likely like to be able to hear that and rather see it in sign language. Are you planning on signing the results, having them in American Sign Language, or are you just going to be handing over some paper data? This is Sam speaking. Thank you for that question, Diana. Every project is a little bit different, and depending on the alliance, and our client is Lara for this project. So we plan on turning that in English, a written report. That'll be handed over to Lara. And then Lara, it's up to them what they do to that. They might translate that into ASL, and that would be up to them. As far as disseminating the report or making decisions how we communicate that to the community, that's up to them. So if you feel like the report itself needs to be signed in American Sign Language, that would be part of the data collection piece as well. So I encourage community members, if you have some ideas about the assessment and how it could do better or how future projects could improve, how we could improve our engagement and what communication looks like, that's a part of the assessment. And seeing what the state of Michigan and the people of Michigan actually want. So please put that feedback into the survey as well. So as of right now, our final report is not going to be turned over in ASL. It'll be done in English.
And this is Shane. I just want to add to that. When we met with Laura in person in Detroit, we sat down, we talked with the staff about the scope of the project, and we learned that Laura looked at us, as a partner to help them understand what the community wants. What does that look like? So that type of feedback, we're going to give back to Laura and make sure that they're satisfied with the expectations and the needs that they have. So they really care about the interpreting community. They care about the deaf community. So how do we do things right? What does that look like? And part of the support of that project depends on that. And then also, we understand that Laura also has a long-time commitment to the interpreter community and support of the deaf community. So they don't look at this as a one-time thing. This is going to be a continuous project after this initial phase. So this is a preliminary project to help them understand really what things should look like going forward and how those projects going forward should be built.
This is Sarah. If I bother them enough, annoy them enough, is it possible for you to get the report in sign language? Is that possible or impossible for a fee or whatever it might be? Is that something that's even a potential option?
Yeah, so this is Shane. Not impossible, no, not at all. We want to represent, if we want to represent things in ASL, what are the capabilities? What does that look like? The reason why I say that is because part of our work, Sam and I, when we began, like with the announcements, maybe you saw the two announcements, the one from Laura about the project. The first time there was an ASL announcement out to the community. And so there was some learning, some collaborations there about what that would look like when you do that. And part of the commitment with them was helping them to understand why that's important. Language access, having it visual so that it could be understood in sign language, the importance of that. And so we worked together on that. We supported Laura with that. We support your board, and that's kind of what our role is, to help understand and improve the communication, make it happen in ASL. So to be clear, our company doesn't have the capability to do those videos. We have to outsource that, and so we would have to bring that back. Now, locally in Michigan, there is a company that can do that, and so that's where the issue is trying to figure out where we get that resource and how we use it.
Thank you. Does the board have any other questions? Seeing none, Well, I would like to thank you. Thank you so much. This is my first time being board work quite like this, so I didn't know if I could say hi, farewell, goodbye, or do I just hang up on you? I'm not exactly sure what the proper etiquette is here. Okay. I thank you for your time and your information. We look forward to your report. Okay. This is Sam and Shane. Thank you, everyone. Thank you.
Thank you, Inavi, Sam, and Shane for participating today. I think we're going to get our PowerPoint up. I know Colleen's working on that, so just 1 minute for that. While they're working on that, I wanted to start off by saying welcome to Miles, our newest board member over here. We're so happy to have him join us. He was appointed in February, so I'm excited to have him joining us. Also, while we're getting things set up, I do have a few of our staff from BCHS here. Could you guys just stand up? I know you're in the back. They are, and just a wave. So Andrew Shefsky is in the pink right there. Yep. He is our manager of the long-term care state licensing consultative section. So they work with nursing homes and do education and consultation. Jackie is beside him. She's one of our nurse consultants who does training and education as well with our nursing homes. And then Matt Jordan is behind Andrew. He is our state licensing, non-long-term care, state licensing manager, and he oversees the licensure process for places like hospitals, surgery centers, substance use disorder, and hospice, right? Did I get it all, Matt? Birthing centers. Yes, newest one. That was a new addition. So they joined us today to kind of hear a little bit more about what's going on in our deaf community and with the qualified interpreter community. And I think Colleen has this up now. Can we skip past the NAV slides, please, Colleen? So I think to slide 4. All right, so some of this Sam covered, which is why I skipped the first couple slides. I know she discussed that, oh, we're waiting. Sorry. The interpreter's too small.
I know, it's not giving me the proper size.
We can probably just cut off the slide a little bit, and this will be, or is it available already, Colleen, or not yet? The slides afterwards, I think, usually okay. After the meeting, we will post these, so the slides, so we'll get, you're good? Okay, sorry. Okay, I think we can get started now on this part. The interpreter shortage investigation board subcommittee report was shared with NAV. I know Sam mentioned that, and they took that into consideration when creating the survey for the community. Other things that we have going on in the Bureau is we've attended the Michigan Department of Civil Rights, DDBHH, council meetings in February and in May. So we've been part of that, and I know Diana and James and Mitch shared a little, and Sarah shared about the Flint Association of, Flint Deaf Association meeting in April that we attended. We've also reached out to Boys Town regarding the EIPA and their educational interpreters, just to kind of collaborate a little more with them to understand some of, because we do get a lot of questions about that. While we don't proctor that exam, it would be nice for us to get some more insight on the process and possibilities for collaboration. And then I know it's been mentioned we're working with Mott Community College for the fall board meeting coming up in October. We will have those meeting dates posted on our website, and we will hopefully be finalizing those dates soon, but it'll be in October sometime. Let's see. Next slide, please. All right. So the administrative rules and what's going on with that, I know that's been a big topic of discussion. As mentioned in previous board meetings, we have had the preliminary work group with the board, a couple of the board members, to help us advise drafting the rules. And we requested for the RFR for rulemaking. That has been filed. We're moving forward on that. We were trying to make the rules more concise, easier for the community to read and understand, and take out some of the extra that maybe we didn't need and be more concise with those. The draft rules have been shared with the board. They've been shared with MDCR and MDE, and we're collaborating with them on feedback, and right now working with DPAN to get the videos finalized to be released to the community. We anticipate sometime this summer being able to release those videos and the draft rules in ASL and English. All right. So the testing statistics, I know we usually discuss these at every board meeting. We did have about 45%, and now this is from October 2024 through May 2025, about 45%, passing the TEP test. And then for the BEI performance test, we had about 33 at the basic level, 13% at the advanced level, and so far we haven't had anybody this time frame pass the master. All right, next slide. And next, I would like to announce Peter Norland. He is our newest interpreter with our team. We're excited to have him. He's over here at the table. He's going to present some statistics on the data that we have with the QI program and interpreters. So Peter's going to be also assisting with our day-to-day operations in the QI section. He helps to develop and conduct and evaluate internal and external trainings, and we will also be working with him to put out some resources regarding the program. And with that, I think next, oh, this isn't quite Peter's yet, is it? Sorry, guys. Okay, draft. I think this I just covered, Colleen, so we can jump to the next slide. I must have got ahead of myself. Oh, this was, I'm sorry, misunderstood. This was just kind of to show some of the efforts that's gone into creating the draft rules and where we're at now. While we're translating them into ASL, there were about 127 video clips and approximately 9,000 words to be interpreted. So as you can imagine, it's a pretty big project. And so, as I mentioned earlier, we'd like to have this project completed by July and out to be posted for the community. And now I think I will be turning it over to Peter.
Good afternoon, everyone. My name is Peter Norland. I'm a qualified interpreter. I joined the program in March, and I'm very excited to be here. When I joined, I was given the task of helping complete the interpreter statistics project. Some of you may recall that a presentation on this topic was given towards the end of 2023. I want to give a big thank you to Matthew Straubin, a student working with the program who undertook quite a bit of effort to get this project started, and we worked together to complete it. So thank you to Matthew. I'll be talking about some of the broad strokes of this information, and it's important to information to understand because many people who use interpreting services have had the experience of being told that no interpreter is available. So, this information helps us to understand where they are. Where are the interpreters? It's not the full picture, but it helps us to get closer to some answers. I want to stress a couple things. The first is that what I'm presenting today is just a snapshot, a moment in time about something that's constantly changing. People registered with the program have their certifications expire throughout the year. Some of them lapse. Some of them go some time without renewing and need reinstated. Others send in initial applications or are adding endorsements all the time. So you'll see some comparisons in here that show no change. I want to emphasize that that's just because this is a snapshot in time, and the actual people that make up those numbers might be different from 2023 to 2024. This information was downloaded from the database, Michigan Online Interpreting System, on October 31st of 2024. So the numbers we discussed today are different from what are actually in the system today, and that's just because of the limitations of our database. Once we get a new database, our reporting will be much more up to date. Matthew and I took many steps to make sure that this information was correct. However, because the system is old and has a number of inconsistencies in the data that gets downloaded, just from what we're starting with, it's possible that there could be some small inaccuracies. As of October 31st of 2024, there were 1,040 interpreters registered with the QI program. Most of them had a standard level 2 qualification. A smaller number were qualified as a standard level 1, and a smaller number than that had a standard level 3. Almost all of the states in the United States are represented here in the qualified interpreters that are registered with us. We'll say a little bit more about that later on. You'll notice that the most common endorsement is the medical and mental health endorsement, followed by the deaf-blind endorsement, and then the legal endorsement. There are 26 substitute or underqualified EIPA interpreters registered with the state, including those with an address of residence outside of Michigan, where there are a couple. And for those who might not be familiar, substitute and underqualified EIPA interpreters have an EIPA score of 3.5 to 3.9. Next slide, please. This information is limited to those with an address of residence in Michigan, a smaller subset of the overall registered interpreters. The same patterns can be seen here. Most of them have a standard level 2 designation. A smaller number have a standard level 1, then a level 3. We've also included who has which certification, which type, a BEI or an EIPA or an RID. On this slide is where you can see what I mentioned earlier. The numbers in parentheses are the amount of change for that category compared to the last time this information was presented. And you see a couple times that there's 0 in parentheses, that might not be the same people in those buckets, but comparing, weighing the two buckets, there was no change between the two snapshots. Next slide, please. This is a visual demonstration of the distribution of interpreters by their standard level. Most interpreters have a standard level 2, both inside and outside of the state. Or no, this slide is just for Michigan interpreters. Next slide. Out of all states, most interpreters have a medical and mental health endorsement. Next slide. This graph shows the number of interpreters with a standard level 1 designation and interpreters with a level 1 designation and a deafblind endorsement. Next slide, please. This graph shows how many have a standard level 2 and then how many also have endorsements. 490 also have a medical mental health endorsement, 91 have a deafblind endorsement, and 83 have both. Next slide, please. At the time of this data poll, there were 62 interpreters able to work in legal settings out of all states. 56 had a medical and mental health endorsement. 22 had a deafblind endorsement. 21 had both a deafblind and medical and mental health endorsement. And 5 didn't have any additional endorsements. Next slide, please. In order to be registered as a qualified interpreter with the state, you can have one of 3 types of certifications. You can have an RID certification. The NIC, for instance, would place you as a standard level 2. There are a couple that would place you at a standard level 1. You could have a BEI certification, or you could have an EIPA certification. This slide shows the distribution of who has what. Most interpreters registered with the state have an RID certification. If you were to take these numbers and add them up, you wouldn't get to 1,040. That's because some people hold more than one. Next slide, please. If you're interested in knowing how many people hold 1 or more, perhaps even 3 certifications, that information is showed on this slide. 13 people hold both an RID and a BEI and an EIPA. Next slide, please. This slide is new compared to the last time the data was presented. We were able to dig a little bit deeper into the data and do a little bit more work to clean it up. This is what we found. So we understand it's a matter of interest to the board. On average, those with an EIPA hold either a 4.2 or a 4.3. And you can see the numbers that hold less than a 4 and over a 4. So that shows the distribution of interpreters by type as well. Some interpreters hold both an EIPA elementary and an EIPA secondary. The surprising takeaway from this slide is that most interpreters registered with the QI program send their application with an address listed that is out of the state. 573 reside out of the state. 467 have a Michigan address. 47 states and 3 countries are represented in this list, including the United States. Canada and the UK are the other countries. Next slide, please. This slide shows the number of interpreters by county. What we noticed from the slide is that there's an uneven distribution of interpreters throughout the state. Just 11 counties have at least 10 interpreters who reside there. There are 46 counties in this list. There are 83 counties in the state. Next slide, please. This map is difficult to see on the screen. For those who are here in person, we have maps available that you can take a closer look at. The pattern that emerges from this map is that most interpreters are centered around Detroit and Flint, then Grand Rapids area. There are a few in the upper end of the Lower Peninsula, but there's also a band of counties that stretch across the knuckles of the hand, we can use that colloquially, that don't have any interpreters registered at all. Most counties in the Upper Peninsula don't have any registered qualified interpreters. Next slide, please. This is the same information that we've just discussed in a table format with additional columns to allow you to dig deeper into other strata of the data, such as who holds an EIPA and only an EIPA, standard levels, and endorsements. This table is continued onto the next page and the next slide. Next slide, please. This is another map focusing just on the underqualified or substitute interpreters who are registered with the program and where they are throughout the state. Most, and I believe all of them, are in the lower part of the Lower Peninsula. So for this information, and for the next time that we present it, we would appreciate the board's suggestions on other ways to look at the data, other graphs, tables, maps that you would like to see. We could explore what might be possible. There are limitations because we have to follow what is available to us within the MOIS, Michigan Online Interpreting System, our database. But to reiterate some of the patterns that we saw, most interpreters reside out of the state that are registered with the qualified program. I think that's interesting. On average, EIPA holders have a 4.2 or a 4.3. That's information we didn't have before. And then finally, there are large portions of the state that are likely to be underserved. Many counties that don't have any interpreters residing there. Information from the Not Without Us census suggested that there were not interpreters, but deaf-blind and hard of hearing individuals distributed throughout the state. And that doesn't seem to be reflected in the distribution of interpreters. That's the end of my presentation, and I welcome any questions.
I'd like to recognize James.
This is James speaking. So thank you, Peter. This is, your creative way in collecting this data, putting it all together so that we can get a look at it, categorized, giving us a new perspective so that we can see it visually. Thank you very much. And just to let everybody know, prior to Peter coming on board and being hired, when we typed the subcommittee report, I did talk to him to try to get some help with this. And I think I've mentioned, mentioned at the BCHS, but it's a visual impact, and looking at that is much better than just numbers, right? We can actually look at the state, and we can see those empty white areas where there's no numbers. That band across the knuckles where there's nothing, right? And there's nothing in the UP as well. So very nice. And we saw that adding that visual acuity to it is just great, So now we can see it, and it's like, ooh, you see something, it kind of hits you and sticks with you. So appreciate that. And then I want to encourage the board. We can right now look at this, right? Get over our shock and awe. I mean, that's how I felt when I looked at this, like, oh, man. Avoiding blaming the BCHS and, and what can they do, as we look at this, I'm trying to think of the right comment. BCHS, responsibility has been to watch, right, to monitor, to, last year, we finally got some information together. We got Peter and his information and all the data that he brought. So we have like a bigger picture, a brighter picture. We can really see the total picture. But, they can't really look to us, right? They will look to us, BCHS, as to how we take this information, we take this data, and then we look out to the community and, how can we get that everywhere? As a board, it's a moment to really wake up and see that information. I think we had 8, there's 8 of us. Last year, I think this being the first time they brought us that data, we just, everybody was talking about it. We were like, look at all this data, look what we have now. So now again, we have some more information, right? We have 2 years of data to compare, and I see a lot of things that are just like, whoa, how many interpreters, have we lost? We've lost interpreters, and we've lost in different fields, and this community, we got to start being creative and trying to figure out, what do? We take this data, they're going to look to us, and some of them are going to say, hey, there's some data missing here that they can't get for us, right? Like how many interpreters don't show up for appointments? We don't track that. There's no way to track that. So we in the community have to really figure out a way to move forward and get some of that data and how to track that data. One thing I can ask BCHS is to please, I'm looking at test scores, and they're really the same as they've always been. There's not much change in the test scores at all. So, we can't change the test, right? We know that. We can't change the test. We don't have authority over the test. What we can do is we can, for those that come in and apply for the test, take the test and complete the test, do we ask them for feedback, right? Can we, get a pulse of their experience? What was their experience? What were their barriers, if there were any? I'm not sure, but I'm just kind of angry at the moment, but, we sit down and think about it, or when I can sit and think clear, can we make some recommendations to them and say, hey, we would like you to, for those that take the test, we'd like to ask them these following questions, do a survey on their experience. And that survey would be under their control as well. As a good example, who has tried and failed numerous times? Can we take a look at that and analyze and find a gem as to why maybe they failed? Maybe it's a barrier. Maybe it's something that we can address. See, can we? So the data will, it's going to be our life, right? Our life, it's either going to make us live or it's going to kill us. We will live and die by the data. It's just, I'm just so, it's maddening with this information, right? And honestly, as interpreters, we've been out in the community forever, and man, we just haven't had data at all for all these years. There's been a serious lack of data. So maybe BCHS can get with an interpreting agency affiliate. I don't know if BCHS, do we have data resources? A collection tool, some training for people that are involved in the interpreting field where we could collect data from them. Can we get more support from them? I don't know. I don't answer those questions. I'm just throwing it out there. All right. Thank you.
Any discussion? Sarah? That's Peter, right? That's your sign name? Just making sure that's right. All right. Thank you, Peter, for your hard work on this. But something I did want to put out there, language matters, words matter. And EIPA, that is not a certification. That is an assessment. That's an assessment tool. So it's important that we're not labeling it as a certification because they are not certified interpreters. This is an assessment that allows them to work within the educational system. That's it, in the schools, period. So it's important that we use the appropriate language. EIPA, again, is not a certification. It is just an assessment. I just wanted to put that out there, that little tidbit. You know me, I'm the one who's always going to bring it up and mention things. The interrupter.
This is Miles speaking. Yeah, going back to the EIPA, so I know you said that average score was 4.2 or 4.3, but does that really represent who's registered in the state, right? So the board here, BCHS, we really need to have more enforcement on those that are out there working that are underqualified, correct? Because 28, there's no way that that's the number. I mean, that are out there working. We have way more people working out there that are underqualified. So partnering with, whoever we need to partner with, contacting whoever we need to contact, to enforce that rule in the state and make sure that we have accurate numbers, because it would be interesting to see what the real average is. I mean, 4.2 seems good, but we got many people working that are underqualified. And that's a problem for the schools, problem for the deaf kids, problem for the deaf community, big problem. So just my 2 cents.
The topic, this is April, of EIPA, says 26 are underqualified. I was just curious, we're limited to what data is in the MOIS system. Is there a way, a workaround to ask for enforcement data? We know 26 that are registered that are underqualified, but we know that there are many that are not registered and hiding in the shadows and working unqualified and unregistered. And I'm curious how many people are filing complaints or how many people have been rejected from the registry. And how do you enforce that? Can we figure out that data? Is that a potential? We know that there's been an issue with the EIPA, the school interpreters have no credentials, they have no EIPA, they're just working underqualified. Is there something we could try to do, or are we able to improve that? Have some sort of enforcement and response to that in order to get them to stop working if they're unqualified? How does that work exactly?
This is Diana. And, yeah, and still on the subject of EIPA. She said Upper Peninsula has no interpreters, right? You and I know that there's a lot of deaf people that live in the UP, and there are people who are acting as interpreters. So, you know, we need to find out who they are somehow. Hey, when you go to the doctor, who do you use as an interpreter? How do you do that? Man, I can't imagine that of all the people of the entire UP, nobody's interpreting. I mean, obviously there are, right? There's got to be. They're working under the guise of being an interpreter. You know, they have an agreement with the doctor. You know, somehow they have low rates or something. They have some type of agreement with the doctor, so they get that work. So that's something that needs to be investigated. So is there a way that we can get a hold of the ISDs and find out, you know, how many exceptions. Can we find out the number of exceptions? How many times exceptions have been used, you know? Or is there a limitation to that? Or is that confidential because of the Children Privacy Act? I don't know. I'm not sure.
This is Sarah. To add to that, isn't there already a limit that's been placed on how long you can work be underqualified and work with a waiver? And is there anything that we do about it, or we just allow them to keep working for 3, 4, 5 years with a 3.5 with no ability, with no chance to improve their skills, or not even trying to improve their skills? And that's because we're not doing anything? That's not the word I want to use. It's important that, I understand that we don't have enough, correct? We get that, but we don't want interpreters who are unqualified causing harm to our deaf community, my deaf community. And I understand that the shortage is there, but it's not okay for them to just continue on without credentials. That's just a little tidbit about myself. I had to leave work. I had to leave this field for 2 years to go work at the cashier, and people looked down to me, and I had to do that, and I worked, and then I took my GED, and then I took my TEP, and then I took my performance test. So I had no empathy for those who feel like they can just run amok and doing whatever they want to do. It takes work. Get up and work. It takes work and effort.
I work, you work too. Just make sure that clear. I work hard, y'all can work hard too.
This is James. Data's passionate subject. Very passionate, right? So a good example, you know, we want, you know, the community, you know, so many smart people in the field, interpreters in the community to take a look at this. You guys should take a look at this data. For example, while I was looking, the entire state, you know, count how many EIPA assessments are what, 193, right? That was the entire state, right? RID, EIPA, then BEI, EIPA, then just EIPA, right? I think it was 93, right? The entire state.
The state of Michigan.
In the state of Michigan, it was 174?
In the state of Michigan.
Okay. 193, but 174 live in the state of Michigan. All right, so we have interpreters working here, educational interpreters who live outside the state of Michigan. Well, maybe some in Ohio, Indiana, Illinois, perhaps, just across the border. And some virtual, right? That's all they do is virtual for schools, right? That's it. So, we can't say, well, I know. Well, we have numbers now. We have proof now. We have, we can show that, yeah, there are some interpreters that live far away from the actual schools here, and those schools are interpreting those, or contacting those far away of interpreters and using them virtually. And that has an impact on education and development, no doubt, So one example, just quick, in 5 minutes, we just found that. And then another example, a board member just recognized that in the state, well, in the entire state, 83 have an endorsement, medical, mental health, plus deaf, blind, in the entire state, just 83. So just FYI, what's interesting, when we look at that, like for me, I work at the University of Michigan Hospital, and I have a team of about like 25 interpreters there of us, 25 of us. We all have medical, mental health, and deaf, blind. So of those interpreters, those 83, 25 of them work for the University of Michigan. That's a very small microcosm. And then 10%, as Miles said, in Flint. So that means that there's about 65% for the rest of the state that have those endorsements and certifications. So that means, what does that mean? That means, okay, not 65%, but what's that mean? 40 people? Medical, mental health, plus deaf, blind, all those endorsements, 40 people are available for the entire state of Michigan if they don't live in Ann Arbor, if they don't live in Flint. So that's just something that really hit me. I just impress upon you to get that out there. Please take these numbers, look at them. What do you notice? Give us that feedback. There's smarter people than us. Peter's smart. Everybody's smart. UCHS is smart. I'm, smartish. But there's a lot of people that are smarter than us that can analyze those numbers. Please do that and help us to, get that vision and see what's really going on out there, where we can roll up our sleeves and address these issues, please God.
This is Diana. I have a comment to make. We could talk until we're blue in the face about numbers. But you're a numbers person, I know you are. However, I see deaf people who go without interpreters, those who are frustrated. So it's a bit more personal to me, not such a numbers game for me. But it goes back to testing. Testing. Why are they failing the test? We have all the numbers. We could get all the numbers we want, but we need to start there. You can't work without passing the test, and the failure rate is high. So there's got to be something wrong here. Taking a look at the test, perhaps that's what we need to do again. Do we need to have our own team here to track it, to rate it? I'm not sure. I have a feeling it's the test itself. We never have increased the number of interpreters. That we keep failing tests is what happens, and some of them are not passing the NIC. So how can we do that? I misspoke here. I said that they're failing the BEI, but they're passing the NIC. So that tells me, how is that? How is that possible? Could it be state-focused, and the other one is nationally focused, and they're passing that? So we need to take a look at that.
This is Sarah. Just to let you know, the NIC is a basic entry-level test. The BEI is a skilled-based assessment test. People who can't pass the BEI because they don't have the skills to do it, and I'm not talking about English, I'm talking about their sign skills, their sign-to-voice skills. The NIC is a basic, 70%. You have to know 70% to pass that test. And then on the BEI,
Currently 70, but before it was 60.
okay, you're right, thank you. Yeah, we just had this conversation a little while ago, so thank you for clarifying, thank you. But yeah, so currently, the new test, it's based on 70% knowledge, but formerly it was 60%, right? It was 60%. So people who can go and take the NIC, they can pass it, or if they took the old test, even before that, where they only had to get 60%, they could pass that as well, right? Get their certification. And then we look at the BEI. The BEI is the BEI 2 is what, 70 to, at least BEI 1 is 70%, BEI 2 is 79 to 80, right? So it's weighted up that way. So the BEI really is more of a skilled-based test compared with the NIC.
I understand that.
Yeah. So that's how it's easier to get national certification, the NIC, and then when those same people go to take the BEI, so it's not really state-focused, it's skilled-focused.
Yes, that's true. I may agree with that statement. Yes, it is state-focused. However, to the deaf community, RID credentials are the best, or they outweigh the BEI.
Yeah, that's why I'm telling you right now that that ain't true.
Is that not true? Okay, that's my understanding.
Ooh. Rolling. So as a college professor, also, I provide workshops. I do those types of things. The BEI 3, or 2, or the 3, very often, a lot of organizations say, oh, well, we have, RID certified interpreters. And I'm like, I would prefer someone who has a BEI 3. If you can't find them, then I'll take someone who has a BEI 2, just me personally.
This is Sarah speaking. So it's important to get that information out there as well. Just because you have an NIC or RID and you think that's the best of the best, that's inaccurate. It's just not true. It's just not true. That's something that needs to be put into the community and put out there. NIC does not outweigh the BEI. Education needs to happen within our community to show what certifications look like, what it means when you have this, and what percentages look like, including the EIPA, the 4.0. If I'm not mistaken, that's still 70%-ish. So that.
Okay.
Any more discussion? This is Diana.
So there were a couple of questions that I'm not sure were addressed to me that I do want to give a chance to respond to. I'm not really able to respond myself to all of the questions that were posed because of my length of tenure with the program. I've been here a month, guys. But I can say, thank you for the note about the EIPA being termed an assessment. I do not recall what it is termed in the rules, and I do plan to go back and look at that, but that might be a matter of interest to the board, whether it's called a certification in the rules or not. So I plan myself to go back and check and make sure that I'm using the correct terminology. I also do recognize as well that it is important to stress this is information we have. We don't have the entire universe of information that's out there. It's what I presented to you is who is registered with us. So yes, absolutely. It is possible that there are a few or many interpreters who are out there working. We just don't have the data to to say yes or no. And we do have a complaints process that would be one way to gather and collect some more of that data. In terms of whether we have the authority to go out and do more enforcement, that is a more complex question that I don't have the answer to, but I believe that we have some limitations. We have to be authorized to go out and do things. So that would be a question best answered by someone else in the program. So.
This is Mitch speaking. Thank you, Peter. Going back to talking about enforcement. So you recently mentioned some things about we have to be, given the authority to do things. For me, it's simple, though. I mean, I'm just such a simple person. It's true. I am. So you mean you need somebody to file a complaint, right? You can't proactively investigate, go in, a little bit cloak and dagger. If you don't have our ID, raid. You can't go in, have a raid, find out who's interpreting here, give me names, we need somebody to file a complaint, correct? So, that's really what we're waiting for is people, complaints. So the four of us, what we learned from the FAD town hall meeting was like, whoa, the community and the interpreters do not understand the complaint process at all. They're like, is it BCHS? Is it MDCR? If I tell the interpreter agency that I work under, is that good enough? So again, I feel like if we want some enforcement, we have to educate the community about filing complaints and then also making the complaint process just simpler. I'm just so jealous that MDCR has, this new navigator. I don't know what you call it, but, she was up there, made those comments, and it was just like, man, can we borrow her? Can we share her? Can we reinvent her, clone her, something? I mean, that is so cool to have a deaf person that can help navigate through that process, both the cultural information and to be able to have that go both ways. I mean, that's fantastic. So whoever came up with that, hats off to them for that role. We need one of those.
That would be Kenya. Director Lowe. This is
So
Diana.
at this time, I'll go ahead and give it back over to Heather Hosey. Thank you.
I should have just mentioned to Peter to send it over to Larry because he's up next. And since we're speaking about complaints, I think he has a little bit of an update on that, as well as some other things. So I will turn it over to Larry Horvath, our Bureau Director.
This is Larry speaking. I am the Bureau Director for the Bureau of Community Health Systems inside the Department of Licensing and Regulatory Affairs. First, want to, on behalf of Director Brown and myself and our team, thank the board for all your work. We hope that you feel supported by the Bureau, and we're getting you to ask us the tough questions so we can make sure that you get the information you need. I also want to thank our staff for all their work. I want to acknowledge the students that are out there. It's fantastic. For those students, could you stand up? I think it's great that you guys have attended this. So thank you so much for attending. I hope you found it interesting. Also, want to thank Madonna for hosting us. I think it's nice to get outside of Lansing. I also want to recognize Miles as our new board member. All the attendees that come to these meetings, want to recognize our partners with civil rights and education. So I want to be brief. I know we're getting into the wee hours. Want to just kind of give you a quick update from the Bureau. In fiscal year 24, The program has cost us approximately $410,000 to operate. We collect about $60,000 in fees, so you can see the disparity there. The $410,000 are only for the direct cost of the program. That does not include our IT support, my support, our enforcement, and our investigators. This is direct staff, our payments to host the meetings, our payments to run the program, the databases, so these are direct costs for the program. Do want to recognize the legislature and the governor for investing $800,000 into the program. So you can see that we have a little bit of flexibility going forward. We have dedicated, of that $800,000, we are dedicating about $200,000 to upgrade our IT system. At a minimum, we're going to do some minor ITs. To replace the whole system, as I said before, to replace the whole system, we will seek additional funding for that. But we're going to make some small steps with the seed money that we got. So we're appreciative to the legislature and the governor for making a long-term commitment to make sure we have a continuous source of funding besides our fees. I also want to recognize the Michigan Health and Hospital Association, as well as the Michigan Health Endowment for funding the QI survey. We're excited that we're going to get the board some information, some more data, to help us really decide where we're going to go in the future, how we're going to direct policy. We hope that you'll see some improvements in the system here within the next year, such as online payments. These are just small steps, and we are looking at other things. As far as the rules, we hope that the rules will be released publicly soon with our work with DPAN, and we're excited about that. I also want to kind of mention that having the qualified interpreter with our bureau, we think that it's a good match because we've been updating our other rules. And so we are updating our psychiatric rules for our psychiatric hospitals. And there is a language about how do you communicate with your patients. And so we have started to work on, we asked the Department of Civil Rights to look at that language. We asked Sarah to look at that language. How can we better communicate to our other licensed providers their requirement to make sure that they have effective communication with their patients? I do want to recognize, too, that Mitch, well, first let me recognize Rowan's comment that this should not be our last survey. This is just a start of how we are going to help the board really get information to create good policy in Michigan. And I also want to recognize Mitch's statement of the enforcement really comes with complaints being filed with the department. And we will work with our partners at Civil Rights to determine the jurisdiction, but we'll also have to figure out better mechanisms and tools to educate people so they're not confused, they're not frustrated. It's not just in the deaf community that they get frustrated with us. If you file a complaint against the hospital, a lot of people will tell you, why did we even file with the department? So there's always frustration with our investigations because investigations are time-consuming, and you have to get them right. And, you know, you're going to go before a hearing. So when we say that we haven't substantiated, it doesn't mean something didn't happen. It just means that we, as a third party, could not verify that the allegations are true, and therefore we couldn't take enforcement action. Right now, though, we are not getting a lot of complaints. Even though we hear what's going out in the community, we're not getting a lot of complaints. And we have committed the resources to do the investigations. But we will do better in educating because we have to. It's going to make it easier on us if people understand the process and how to file a proper complaint with us. What information do we need? So we hope to do that as well. Keeping in mind that our major focus is always registration and testing. That's our primary focus as a department. But as I end my presentation, I would ask the board, I'm always trying to think 6 months to a year out. We're going to have this survey, So we got that project underway. We're going to have those results. So I would like to ask the board for guidance on what should be our next project, outside of our core project, which is always registration and testing. So should we be looking at public service announcements to educate the community? Should we be looking at a continuing education module for medical providers on how to work with the deaf community? Should we be focusing our energy on how to file a complaint and what is the complaint process? More education on that. Should we be improving test scores? Should we be working with our partners at the universities to allow testing at the universities, not just in Lansing? And should we address interpreting deserts where there are no interpreters? And lastly, we always hear about EIPA. So I gave you just a host of things that I've heard from the board over the years, but I would ask the board, as you guys in your next meetings, help us focus as a department, what should be our priority? We can't take them all on. I always tell people I would like to do 2 things well, then 15 things mediocre. So I would ask the board, help us, direct us on all of these great topics, which one should we prioritize next? So,
This is Diana. You know me. Diana speaking. You did not mention the DI, the deaf interpreters, and that's an important piece. We need to have that in our state. And second, we need it. Hold on, let me back up here. Continued education. Continue education for our deaf community and for interpreters, because deaf community gets frustrated because they don't know what evidence they need to collect in order to be able to file their effective complaint. And many people don't know what the Code of Professional Conduct is and what interpreters can and cannot do. They know that privacy is one of them, and they have to dress nicely. But other than that, they don't have a lot of information. So I think that a continuing education piece for the community is key.
So Sarah, so when you ask, what do we feel are 2 big things, 2 big gets, we're talking about, like what you said, Dan, that's wonderful, but what you talked about with the educated community, can we partner with MDCR for that? Or can we partner with maybe, I don't know Mirrored, but somebody that we could partner with so that you can focus on, which I think is the biggest, most important thing that you have control over, is the hospitals and educating them what the law actually says, what they can and what they cannot do. To me, I think that would be a big help to the deaf community when they go into the hospital and the hospital says, no, I cannot provide you with a live interpreter. You have to look at the screen and use VRI. I know that's not like an interpreter issue, but we're in the right place for fostering some change in that field, in the medical field. We're under you, you're responsible, to serve them. And so, the hospitals, nursing homes, because we have a big population of senior citizens here in the state of Michigan. And, what's going to happen with, older, senior citizens, dementia, how are we going to have communication access for them? What are nursing homes supposed to do? What do they have to do? Is it cultural education for them with the hospitals and with the community in general? So I think it should be a priority. I do think that should be a priority. But I think it's very important for them to know whoever they bring in as interpreter, are they not only certified, do they have right endorsement, are they qualified? Do we need a deaf interpreter? Sometimes it's important to bring in a DI or a CDI so that we can, do we have their buy-in to do that? Because, they typically think about money. well, shoot, we have 2 interpreters, I gotta have 2 interpreters. In the past, I only needed 1 interpreter, now I need 2 interpreters. You know, we have to explain the rationale, the cultural reasons behind those situations. But I think that educating the hospitals on the rules and what they're supposed to be doing and what their responsibility is vital. Because they depend on agencies, right? And agencies don't always tell them 100% of what they're supposed to do. You know, they're just looking for a profit as well. So we need to do that.
This is Miles speaking. I just wanted to add to that, and thank you for those comments. You mentioned that you had developed some language for a deaf psychiatry, and I'm happy to see that we have a nursing home representative here today because they're in the healthcare field, and typically they're denied, deaf patients are denied care and communication access. I work at the hospital, and I see it quite often. A patient will be in the hospital, they stay in longer because they can't get rehab, they can't get access to those agencies, aging agencies, because they don't follow the law. And my own father was in the hospital and was denied by 26 home care agencies before he was able to go home with chemo. That happens often with lots of members of the deaf community. I would like to see some language, perhaps some discussion related to the law and how it applies to those different agencies within the healthcare system.
This is James. Thanks, Larry. Thanks, Heather. Thanks, Colleen. Thanks, Peter. Thanks, everybody. You know, we agree with you. It's the Qualified Interpreter Program, you know, used to be the DOD, DBHH. Now it was taken and it's been put here. It's been put there. It hasn't been the right fit. We feel like it's a right fit now with your agency. So we appreciate everything you do. And you asked for, you know, 2 projects to help you focus on, so we gave you 15, right? You're welcome. I can't really follow that, but I agree with all those, but we want to thank you guys.
This is Mitch speaking. I agree with Sarah. I like the idea of that education piece, teaching the medical profession that are housed under your authority. That feels like that is a proactive move. I know that they should be complying with the law regardless, but this is a proactive approach. And the second priority, I think it's important that we educate the community about how to file a complaint and what evidence it is required to make sure that they have an effective claim, that they were like, oh, okay, I was actually discriminated against, and they did violate, so that way they are able to win that complaint. So those, if I had to pick 2 in the next 6 months, but honestly, your list that you have mentioned, all of them are incredible, and that would be nice. This is Diana, I second that.
This is Larry speaking. I do have one request of the chair, is that I still don't have a consensus of what the 1 or 2 we should focus on. So I would hope that, because I think everybody might have a different one, but at some stage, it doesn't have to be this meeting, but I would like at some stage of what is 1 or 2 that we should be going forward to plan. And I will say this, I mean, we have good partnerships with the long-term care associations. We have good partnerships with the hospital association. I hope it's not because we hold their license. I hope it's because we work well together, that we have a common goal of good care in Michigan. But I think we can bring that. When we did this survey, we brought Michigan Hospital Association to the table to fund this. We now have the ear of the Health Endowment Foundation that Heather went and got that grant. And now they're coming back to Heather and saying, what can we fund next? And they were when they first heard that we wanted to fund a survey for the deaf community and qualified interpreters, they said, this really has not been our focus. And yet we pitched this, and they were pretty excited to come back and fund us. But now they're asking, what other ideas do you have? So, we do have a little small pot of money with what the governor and the legislature, but we do have to fix the database. There's no doubt about that. But we do have some money. We do have some partners. So if you guys could give us your recommendations, that gives us opportunities to find those partners and plan 6 months to a year out.
This is Diana speaking. I'm standing because I have a cramp in my leg. I apologize. My apologies. But the reason, besides the reason I'm standing, I think you've already heard that the medical field is number one. The medical, the psychiatry, as you mentioned, and the nursing homes, the rehabs, that's big enough. And also educating our deaf community on how to not only file, but how to empower them to know what their rights are and that their rights are being oppressed. Because the majority of the time, they don't know. Okay, I can sit now.
And this is Sarah, so I want to make sure, just to clarify, rights being oppressed might not be, we can't, a reason to file a complaint with BCHS. I know what you're saying, but let's just make sure we clarify, because the oppression really isn't related, to the interpreter filing the complaint. If the interpreter's not appropriate, they're not certified, you ask to see their card, they refuse to give it to you. So those types of things with the interpreter, they break the code of ethics, they violate that somehow, something like that. So we need to give that education to the community on how to file those complaints and what the complaint process is, and say, no, sorry, you can't, interpreter can't do that. They can't do that. You can file a complaint in this situation.
I'm still going to be stubborn, as I always am. This is Diana. I still believe that deaf individuals need to be able to be aware of what interpreting is, what an interpreter is not supposed to do.
Yes.
And because that is oppressing them. When an interpreter says, what questions should I ask? Or that's being oppressive. If they, hold on one moment. Say I want to ask the doctor a question, and the interpreter asks me, what was that question? And I have to explain to the interpreter first before I'm giving permission to ask that particular doctor. That, to me, is oppressive.
So this is Larry. Just to sum this up, I'm going to take home with me that our two consensus priorities is educating the community and educating the provider community. And then we can bring some ideas back at the next board meeting. Okay.
Yes.
Again, thank you for all your work that you do, the guidance you give us, and thanks for everybody
Thank
attending.
you. This is Diana. Thank you.
Yes, thank you.
So we have time for a break. Do we have time for a break? Some of us need a break. Take a 10-minute break. Okay, 10 minutes.
I'm like 7:40 now, which annoys me because it's right before my alarm goes off. My first alarm.
In order for us to have you speak, I need to promote you to panelist. So if you can accept that, that would be great.
All right, I muted again.
Ready to get started? Okay. We are closing the new business. Now we are opening up public comment. We're going to start with public comment of who's in person, with who's. If you are going to be doing English, where should you go for public comment? Or right over here, you take a seat next to Mitch. And if they're signing, they're going to stand over by the blue screen where the interpreter is currently standing. Okay, so who is it that tells me there's public comment?
This is Heather Keel. We have an in-person comment card from Yakata Nichols. However, she did have to leave, and she may be emailing her public comments in, and we would provide those at a later time. So if there are no other in-person public comments, we will turn it over to Zoom. Anyone else? Okay, I will turn it over to Tammy.
All right, this is Tammy. Our first public comment is going to come from Christopher Samp. Chris, I am going to ask you to start your video. Okay, Chris, we're ready.
Hello, everyone. My name is Christopher Samp. I'm Vice President of Michigan Deaf Association. President Lawson could not be present today, so I'm in his stead. Wanted to make some comments. He said, please tell BCHS that in enforcement, hospitals need to have full-time staff interpreters, like they do at Hurley Hospital, like Sparrow does. And so we're encouraging hospitals to be more accessible to deaf patients. So that was a comment he wanted to leave. And then also MDA is having a conference that's going to happen this fall. It's going to be in November 15th and 16th. It's called the MDA conference, and we plan on having some workshops, an ASL expo, some entertainment, different events, so we'd like to encourage you to come. For the workshops, we're planning to have 3 CEUs available, so any interpreters that would like to get some CEUs, we'll have 3 workshops available along with CEUs, so you can get that credit if you attend. And we're also looking for some presenters. And so we're looking for presenters, and we'd like to have them by June. And And so we're happy that, remember MDA was super active before COVID. We kind of took a break. We've had some elections for some new officers. We'll be doing that this fall as well. Keep your eye out for the election information. And there'll be more details of the conference, more topics of those workshops as we get closer. So very excited. That is my update from MDA, and I appreciate your time.
Thank you, Chris. I see no other hands raised right now. If you would like to publicly, okay. ASL Janet, I am going to promote you to panelist. Where did she go? Okay, give me a minute to add spotlight. Okay, I believe we're ready, Janet.
Can you hear me? Yeah, my microphone's blocked and will not open for me, so I will sign, and then I'll send my comments in. Thank you in advance, Jeff, for interpreting for me. Hello, my name is Janet Juris, and it's nice to see everybody. Sorry I couldn't drive and get to Detroit area today. But I'm happy to hear that the meeting is traveling, moving around the state. That's very nice. I want to thank the board, as well as Lara, BCHS, for all the work that they continuously do, working on some very important issues that impact our lives every day, and also impact the lives of deaf, blind, hard of hearing on a daily basis. So we need to recognize you for that, so thank you very much. I'm from Lansing. And I have a small agency that I'm running now in the Lansing area. I still interpret in the community. And I know I have a short time, and I have some things I wanted to mention, some different topics that have come up during the meeting I wanted to address. So thank you for your patience as I look at my comments while I'm trying to sign them. NAV, their work with Lara. I understand, I just wanted to put out there that I know that in the past, quite a while ago, we did partner with public policy with public policy associates. And they did do an interpreter survey as well. It was many years ago. I think the state paid them, whatever. I don't know how much, but did pay them to do that. And they partnered with the Division on Deaf, Hard of Hearing, that was the name at the time. And just putting out there, that was when they were under DLEG. And sometimes I feel like, we kind of do the same topics keep coming up, right, every day. History tends to repeat itself. But my point in mentioning that is if Lara, BCHS, if they find that, the survey, the one that was done under DLEG, I think it would be nice to compare that to the current survey that's going on. What are the topics? Were they similar? Have they changed? Is there anything new? Is there something like way out of bounds in one that's not in the other? So this would be pre-legal amendment. So I think it'd just be nice to see if there's been any improvements that have happened since that was done. Is there less concern, or is there greater concern? Are those concerns new? I think it would be nice to compare those two surveys, so I wanted to put that out there. you. And then number two, related to the passing of the test and the statistics that were mentioned. Really, to be honest, we also need to recognize that all people don't become community interpreters. You know, just like with other professions, right? Medical, nurses, things like that. I mean, there's an understanding that they have a baseline for tests that are required. And I wholeheartedly support, you know, recruiting, getting new interpreters, training them, educating the whole gamut of everything that entails. But we've also have to realize at the same time that we don't want to lower standards and practices. For example, here in Michigan, and really around the United States right now, doctors, MDs, general practice, GPs, the numbers are going down. Many are retiring, right? General practice physicians. Does that mean that they're lowering the standards of the test? No, they don't do that. We just have to find another approach to deal with those dwindling numbers. Training, education, et cetera, et cetera. So just to mention that. And then if that discussion, in the discussion that relates to, I know Diana mentioned, hi Diana, long time no see. Hi Diana, nice to see you. I think Sarah and Diana both mentioned, you know, that the test, or Diana mentioned that, you know, NIC compared to the BEI, and understanding that it's really apples and oranges, to be honest with you, those two tests. Because if you understand the BEI system, they have many different levels of testing. WPM, words per minute, it changes for each level. The content changes for each level. There's a whole bunch of things in there that's completely different than the RID system. They give you a test, and it's for all levels, right? Just one test. And so you can't really compare the NIC with the BEI. It's apples and oranges. You know, so I agree that we need to revisit the test periodically, look at the linguistics of the test. We've already confirmed that that needs to be looked at, you know, every 10 years or so, or every 7 years. I don't remember exactly what the statistics were. But for that to happen, then, you know, we might have to recommend that we partner with Texas and recruit another state who already has a contract with the PEI. And then we can invest our monies together and reevaluate that test. You know, if we had contracts with BEI, it would be very hard to give them all of the responsibility to Texas to improve the test if it's just them. So again, there's millions of dollars that are already used for developing those types of tests. So I'm just putting that out there because we don't need to reinvent the wheel, right? We have a testing system, and it's strong. You know, and I agree, do we need to look at it periodically, make improvements? Yes. And then again, you know, it's money, right? It's always money. Number three, related to the topic of, not MDE, but the EIPA, who has waivers, who doesn't. Those statistics, those numbers seem very low. I agree with everybody else. And again, historically, the people that have that information is MDE themselves. You know, we need LAR to partner with MDE, and MDE needs to query all K through 12 systems and see who's underqualified. And then we need to get a hold of those agencies who are bidding on that contract work and providing them, and how many of them are hiring interpreters that are unqualified into that system. I mean, those are crucial statistics. If we don't have those statistics, then really we're dead in the water, right? You know, and we're honestly going back to when I worked for the state. You know, we argued about statistics and numbers all the time, And now, and we had to go back to square one with the waivers, and that's been in process for quite a while. And the reason we brought the EIPA here to Michigan was because of the need to raise standards. And so, yes, we've seen interpreters, they are out there doing the work, but still, they're not appropriately paid, they're not appropriately trained, the system used to hire them. There's a lot of things that need work, and so we need the data in order to make those improvements and to change the system. Without the data, no can do. And last, if I can, one more, indulge me. It's short, it'll be brief. Miles made a comment, and I think he said down 26, his dad was rejected by 26 different places, right, for placement and for care. And, as a CODA, myself as well, he's a CODA, I'm a CODA. Both my parents are gone now, but that doesn't mean I'm done fighting. And Lara's looking for a project. You guys want projects? All nursing homes and rehabilitation facilities are under the purview of Lara, with other federal monitoring as well. So I would agree that would be a wonderful use of staff, training. Well, again, we got to follow the law, but, if people are denied 26 times, clearly somebody's not following the law, plain and simple. And I've experienced that as well with both of my parents, with rehab facilities. Oh, yeah, we have beds available. Oh, they're deaf. Oh, we don't have beds available. We don't have beds available. We don't have beds available. And that's not legal. So where are the penalties for that? We need to see more action from the state and from their purview. CODA's family members are exhausted, just literally exhausted. If your parents are sick, we don't have the time and the energy to fight the state. We need to have support from the state. So those are my recommendations for things for Lara to do: the training, the focus on nursing homes, the rehab facilities, partnering with DOD, DDBHH, Kenya and her team, partnering. That could be a very robust partnership out front. And that's all I have. Thank you very much for your time.
Thank you, Janet. Chris Samp is going to return to us again in a different role with a different hat. You're good, Chris.
Hello, everyone. I am Christopher Samp. Just looking from my role now as the director for the Office of Disability Affairs in the city of Detroit. We're a division under civil rights and inclusion and opportunity. Been there for the last 4 years in Detroit. Detroit's growing. The growth has been quite big. Lots of new businesses, lots of new opportunities being developed, and also a higher demand for ASL interpreters. That's going to come along with that, for meetings, for events, for big events, like the NFL draft, the Grand Prix. There's a lot of big events. And so the problem is there's just not a lot of interpreters in the Detroit area. We're trying to get more. So I saw your presentation, the numbers of interpreters, very concerning. 1,000 interpreters, but half of them live out of state. So we need more in-state, in-person interpreters in the Detroit area. So my team, we're thinking long-term, how do we increase those numbers here in the Detroit area? I'd be happy to meet in the future for some strategic planning, some long-term solutions, try to find some federal and state monies perhaps that we can build on, a pipeline from the community to the city, maybe some internship opportunities. Maybe some of our local colleges have some good interpreter programs. I would like to partner with you and think of different ways that we can support and increase the number of interpreters. It'd be very concerning if in the future we have AI interpreters in lieu of interpreters. I'm not ready for AI interpreters. I prefer a live body. And then another concern I hear from the community is that the BEI, the renewal process is not easy. I'm not sure if you're familiar with the BEI, but those interpreters who have more than 20 years of interpreting and want to renew, so I guess they have a struggle with that process. How can they renew faster? Not so tedious a process. That's just some feedback I've heard from the community. And then find ways to make it easier for newly certified ones. Michigan Online, the interpreting system, the MOIS, the MOIS system, it's very good. I always refer companies or businesses locally to look at that database and try to find interpreters from there. Because I have to be neutral. I can't say, oh, well, this is a good interpreter, that's an interpreter. Please review that database. But if you've noticed, some of those names are not updated. As we're trying to recruit people, we need to make sure that their names get in the database, show their availability. Maybe we have more interpreters than we think. I don't know. I like the database. There's a lot of good information there. Makes it easier for me to refer people. If you need an interpreter, go to the database, that system's in place. So thank you. That, again, is my 2 cents.
Thank you, Chris. Okay, this is Tammy. At this point, I see no other hands raised. I do have comment from an ASL English interpreter, R. Stuckless. BCHS Lara oversees the licensure, but what department within the state would be responsible to oversee the recruitment of interpreters and supporting or developing appropriate interpreter education to support the need in the state? We need to actively recruit people with cultural and linguistic competence, as they are most likely to become career interpreters rather than using interpreting as a stepping stone to move on to other things. Could Laura send an exit survey to people who do not renew? And then regarding the test, the problem is not with the test. It is the idea of taking someone with no or minimal language fluency and expecting them to be not just fluent in the language, but also to learn the process and interpret information with 2 to 4 years. This is not realistic, given there is no space in the state, nor most of the country, where people can truly immerse themselves in the language and culture. Interpreting is not as simple hearing a word and putting a sign to it. Those are all the comments that we have. There's a public comment.
This is Heather Keel. I was notified that there is one more in-person comment. Okay. The individual is filling out their card. Just one moment, please. Our in-person comment is from William Sturdivant. He is representing himself.
Hello, everyone. My name is William Sturdivant. I'm an educational interpreter. I also freelance. I do VRS and a variety of things. I notice an issue that comes up repeatedly is the EIPA. I also notice that the board is incredible, full of qualified interpreters. As far as educational interpreters that are working full-time, we don't have that. So I'm curious, as in future, that maybe we could think about inviting a new board member that is a full-time educational interpreter who is experienced and well-versed, that knows the history about educational interpreting, and that's their day-to-day life is educational interpreting. We often talk about the EIPA as it comes up, but we have no opinions for people who actually affects and those who work in that field and that specialty, and that they can't provide their opinions and their feedback and their expertise if they're not present. So I'm hoping that in the future, we will have more representation for educational interpreters. Okay. Are there any more comments? No? Are we seeing any? Do we have enough? Do we have to make? Is there any more public comment? Or if you want to ask anybody online, I'm not sure if there's anyone else online.
This is Heather Keel. Are there any more in-person public comments? See none. Tammy, is there anything else on Zoom?
There are no additional Zoom comments at this time.
Okay, public comment. Zoom and in-person is now closed. So now we have any announcements. Do we have any announcements? I have one announcement. I want to say hello, welcome, Miles.
Thank you.
I've already told you welcome. You've been told welcome a few more times.
One more time.
Any more announcements? Go ahead, James.
Thanks. This is James speaking. Michigan Registry of Interpreters for the Deaf is hosting a mini conference plus a business meeting. It's going to be Saturday, May 24th. It's going to be an all-day event. There'll be some workshops in the morning. There'll be a lunch break. There'll be a business meeting, and then a follow-up afternoon workshop. We're very excited to offer PTSL, Pro-Tactile Sign Language, all day for that. So that's 6 hours of CEUs for deaf-blind endorsement for those interested. And if that workshop is full, then we will offer something else in the morning, medical, mental health CEUs, and then ethics CEUs in the afternoon. So feel free to register, and you can see the tickets registration information on our website, michiganrid.org.
Where is it, and can deaf people apply for pro-tactile workshops?
Yes, thank you for asking. We'll be in Lansing at Lansing Community College. Anybody's welcome to apply. Right now, we're still trying to, again, cover our costs, right? So we're trying to cover our costs for the PTSL certification for those training, people to come in. So we're trying to do that. So there will be a cost for that, yes.
Any more announcements?
This is Sarah. I just want to say congratulations to the graduating class, the ITP students that are here this year. I know some have graduated from LCC, I know some from OCC, and then we also have some from MCC. And so we want to say congratulations to all of them. We want to welcome them to this profession. Take advantage of MIRID, as was mentioned, and we really hope to be together to help you along your journey so that you can take the test, right, pass it. And then also, secondly, I just wanted to recognize Kenya Lowe. She's here. If you haven't seen her, she showed her face. She's right there. So I want to recognize her for being here today, a new director at MD CR have been doing a fabulous job. So big hand to her. And I think that is all I had.
Anyone else? Any more announcements? Okay, do I have a motion for adjournment?
This is Mitch, I so move.
Mitch, who seconds? Miles, seconds? What time is it? 7:06. The meeting is adjourned. And thank you all for coming out today.